Chairperson, for a kind introduction. Good morning, all the virtual viewers and those who are present here also. Just few minutes back, my dear friend and colleague Dr. Dharmendra has highlighted the importance of DSME, and it is an integral part of management for diabetes. The point is that he highlighted the important aspects and important benefits for the management of a diabetes, in particularly how DSM is important. But how you should do that? My job is to explain that the art of communication is a key for successful DSME. And why DSM is required? Diabetes is a emotionally and behaviorally challenging disease actually, and it affects the self-care capability, and thereby it affects the glycemic control, quality of life, family life, and it increases the healthcare cost. And our patient has to cope up with lot many things on day-to-day basis, like they have to take medications, they have to take their meals, and that to be in a very frequent manner, and they have to restrict the fats, they have to restrict the sugars, they have to restrict the carbs, and at the same time they have to exercise also. Dr. Dharmendra had highlighted at what point of the time DSM is required, but for the sake of this talk, I would like to again explain you that at the time of diagnosis, annually thereafter, in the transition period, that means if the person is from adolescence to middle age group and then the old age group, then you require a certain set of communication with the patient, that you require this precaution, now you need to change this medication, you will have this complication, and at the same time they have their own issues that need to be dealt with effective communication. And when the complication arise, and most often, and most patients do present in our OPD at this point of the time, 70% of the patients do present in our OPD at this point of the time. So how can you help the patient? And for that matter, communication is the key. Diabetes management is the process actually between a physician and the patient. And for that matter, you have to assess, you have to set the goal. That means you both have to set the goal. You will definitely, as a physician, assess, you will set the goals. You need to plan, you need to implement together, and you need to monitor and evaluate. So at each point of the time, you require different set of a communication style. So like example, I would like to give here that if the patient goal setting for HbA1c is 8 from the 11 for a middle-aged man and for an older age patient population, then the two different set of the communication you have to do. It's not the same communication, you can do that. So, and similarly with the other steps also, you should have a different set of a communication style for each step, sorry for that. And why it is important, and again, this is just a reiteration of Dr. Dharmendra's talk. Once the patient do a self-management, then he will eat a healthy, he will be a more physically active, he or she will monitor the blood sugar level, and he or she will again will be compliant with the medications, and thereby they improve the coping skill, and thereby risk reduction in the behavior also. People with diabetes, they have a lot of information with them from the media and those around them. And when they came to your clinic for your consultation, they have a different set of a question, different set of a perception, different set of a belief. And 90% of the time, it is not right scientifically. And at one end of one end of these communications, you are set with a specific goals for that particular patient. You have a scientific knowledge that is evidence based, and now you have to deal with that patient or that particular family. So, and here your communication is the key actually. And many of the time we fail to do so that. Because what we feel that I am right and he or she is wrong actually. What the message he got from the media and what the information he or she got from the patient around them or the other patient is wrong. And that's how you should behave in such a way that without hurting their feelings, you can really change their behavior, change their perception, and change their belief regarding the management of diabetes. And effective doctor-patient communication, there are multiple steps for that. You need to motivate, you need to give some incentive for that, you need to reassure every time, you need to give continuous support, increase job satisfaction for both of them and for your staff also. Reinforce patient self-confidence, that is important thing. And if you do all such things, then it will reduce the cost and improve the outcome. But there are a lot of barriers for the same actually to roll the ball actually. Patient factors are huge actually. They have adherence issue, they have attitude issue, they have beliefs issue, they have cultural and language capabilities, health literacy, financial resources, comorbidity, and social support. And I can add more factors here also. Clinician-related factors, that is attitudes. You can come in front also. Yeah. Attitudes, beliefs, knowledge about diabetes, and effective communication. I think so. In our medical school, we had not been taught about how to communicate with our patient. And that is a very unfortunate part. And why so? Because again, we had been trained in acute care medicine. Chronic care medicine is a whole set of a different ball game. In acute medicine, you just have to do orders. You do ECG, you do 2D echo, you do this investigation, this. And in a diabetes management, at each point of the time, you have to explain lot many things to the patient. And for that matter, each and every step, and for each and every different individual, you require a different side of a communication style. And that is very difficult to do. So for me, if you do an effective communication, I think so your 80 to 85% job is done at that point of the time. Because everybody knows in the diabetes community which drug to be written. It's not the drugs, it is how you communicate effectively is the way for your success. There's a big complex doctor-patient communication is there. We all are human machine, and we have a lot of social attributes and personal attributes, and that affects our communication style. And doctors have perception, patients have perceptions. So I think so we need to juggle around all these issues when you deal with your patient. But there are a lot of barriers for effective communications. We are not talking too much with our physical gestures, physical postures. When patient come to you, and if you are not looking to your patient, and if you are looking to your mobile phone directly, it's created negative impact to the patients. If you are talking, please come, it's created negative impact to your patient. When the patient came to you and you are looking at his or her file, that is a negative impact to the patient. You are looking somewhere else, you are looking to the staff, that is again a negative communication. Every individual culture is very different. And linguistic is a big issue to discuss. Interpersonal is again a big issue to discuss, but organizational issues. You as a team should communicate with your patient. You as a physician, your dietitian, your medical officer, your nursing staff, all should communication in a way that help the patient. Each and every individual is helped by you. Communication is a natural secret remedy for the diabetes. The important highlight is that communication has a no cardiovascular risk. It doesn't require any cardiovascular outcome trial. It doesn't require any pill actually, okay, because pill are costly, okay. And as a diabetes physician, if you do a good communication, as I earlier said, 80% of is job is done by you. And research studies and collaborative work with behavioral scientists should be encouraged to establish the full benefit of communication in diabetes practice. I earlier mentioned how you should behave verbally and non-verbally. These are the 4 quadrants, but there are a lot of other things to be discussed. But important thing is, I would like to mention here is listening. We are very poor in the listening skill. We all physicians are very poor in listening skill. We act as an authority person in our chamber. I am the boss and I should order everything. I should not listen from anyone, not from my staff, not from my reception, not from the patient, not from the family member. I will just order. And Narendra Modi, even if he is talking too much, he is a wonderful listener actually. And listening is the only I would like to say, which carries a 90% mark for an effective communication style. We are very poor in listening. So just improve one skill at a time. Just listening, that will serve the purpose. Paralinguistic, that is phonation and kinetic. That is a tempo, speech volume, pause, melodic speech, sound articulation. I think so in this COVID pandemic, we need to work on this phonation because our facial expression is masked by wearing continuous mask by us and the patient also. So you have to rely on too much on the phonation. Of course, gesture, postures, we need to improve ourselves actually, and it has to be done constantly actually. Okay, how can you do that? A simple tip I would like to give: put a video camera in your chamber, and at least in a week, just listen your communication style with your patient 15 to 20 minutes, and you can come to know that how bad and how good and how improving you are. Tips for better communication with patients. I think so the time allotted to us is 25 minutes. In the agenda it was 25 minutes, and now somehow they have set a timer of 15 minutes. How it come? Yeah, increase that because I had prepared my presentation, the time slot given to me in the agenda. Okay, yeah, thank you very much. Tips for better communication with the patient. Again, eye contact, listening, I earlier mentioned, silence. Just a silence of 5 seconds makes wonder. And if you carefully listen, CNBC Navy news reader and our TV news reader, our news reader are speaking continuously. We have a news that is rapid fire news. In a 1 minute they speak a lot of things actually. Okay, and compared to Western populations or Western people, we speak much faster actually. Look, I am speaking in front of you, and if I will not pause actually, once I speak, you hear, and your brain process that information actually. Understand, this is a super human brain. It processes the information very fast, even much faster than our present computer, fastest computer. But still there is a time lag actually. Still there is a time lag actually. And we are not giving that time lag. Even I paused for a 3 second, everybody was looking at me. So I am catching your attention. And that's how you should do in your communication style also. Empathy and warmth. Actually, we fail to do so that. The reason is that to give empathy and warmth, actually, we should be full of energy. We should be full of positive ideas and positive energy. And how can you do that? Just set a time aside for your meditation actually. Okay, we require a lot of meditation because we are facing or we are getting a lot of negative energy from the patient and patient relatives actually, unfortunately. And we are at the end of the day full with a lot of negative energy. So we need to go back home, do meditation and came back with the positive energy. Then we can empathize. These are the golden rules of effective communication. Recognize the importance of patient empowerment. Number one thing, just give a responsibility to the patient. That's the important thing. Use appropriate words and language. Be practical. Okay. As earlier mentioned, HbA1c goal for a 65-year male and 45-year male is altogether different. Everyone knows that. But how you communicate to reach that goal, that's the key. Be non-judgmental. We are too much judgmental for each and everything. Okay, each and everything. And we are taking that judgment on ours also. And that should not be due. Reward effort, not just the outcome. Consider the cultural issue, religious beliefs, and personal values of the patient. Yeah, some patient in your OPD came said, I just don't want to control my blood sugar level at this point of time. I would like to get rid of the symptoms. And we know scientifically that if you control the blood sugar level, then and then you will get rid of the symptoms. So just talk that, yeah, we will relieve your symptoms. We will not control your blood sugar. Just go along with them actually. His beliefs actually. And over a period of time, he will understand or she will understand. Stay tuned with the patient feelings actually. So every time care the patient feeling. That's the important aspects. And this is important aspect. We speak too much about just watching the visuals actually. Okay, that's the key. So again, show pictures, video and photograph in your clinic actually. Again, 20 to 30% job will be done in your clinic actually. Okay. Check patient memory for recall instructions. It is very difficult to do in practice, but just ask that what I had told you earlier. When 50% of the patients say, I don't know actually, and 50% say, yeah, I know, but I am not following that. Okay, but the recall is the important aspect. Now, the most important aspect of today's talk is training a doctor should include actually. We all must be trained for effective communication, whether it is a phonician or linguistic. Communications training has been found to improve the doctor-patient communications, and it improve the behaviors elapse over time. So that's why I told you that it is very difficult to get communication training, but that is why I put one tip to all of you, give a one tip, just record your video, do a meditation and improve day by day. It is very difficult to do. We are human machines, very effective, very good at work, but we are very notorious in terms of communications. Take home message. Diabetes is a challenging chronic disorder, affects emotionally and behaviorally. At all stages of diabetes, DSME is required. It's an ongoing process, and therefore communication is the key. And there are a lot of barriers, patient and physician related, for the self-management of diabetes. And by way of effective communication, we can really delineate, or we can really reduce those barriers. Communication is a natural secret remedy for the diabetes, and I am putting on top of everything. Verbal and physical communication is the key, and for that matter, we all require a continuous training for effective communications. Thank you very much for patience listening, and